Hi, we are having a conversation with Dr. Patricio Reyes. He is neurologist at Barron Neurological Institute in Phoenix, Arizona. Dr. Reyes, one usually associates Alzheimer's disease with loss of memory, but Alzheimer's is more than that. What is Alzheimer?
Well, Alzheimer's disease is a form of brain degeneration, and the brain develops lesions such as senile plaques and neurofibrillary tangles. It is usually accompanied by certain symptoms. That includes memory loss, some difficulty with language, comprehension, understanding certain concepts, as well as some symptoms associated with changes in behavior like depression, irritability, anxiety. The third component is clinically some difficulty carrying out the usual activities of daily living. They have difficulty dressing sometimes, checking or balancing their checkbooks, driving, or doing regular work at home or at work. And so these activities may decline as well. So there are three groups of symptoms that we usually sort of look for in patients with Alzheimer's disease.
So I guess as it is with other diseases, early intervention, early detection is important. But how can someone have an idea if loss of memory is an early stage of Alzheimer's or is just loss of memory?
There's no question that as we get older, we also forget a few things. But the big difference between the normal aging process and Alzheimer's disease is the fact that in Alzheimer's disease, the symptoms affect the social and or professional function of the patient. Whereas in the normal aging process, one may forget a few events or episodes, but they're able to cope with the daily activities. They're able to socialize and function professionally.
And what does early intervention consists? What is early intervention?
The best advice I could give is if there's a question that a loved one or a friend may have the symptoms, is to seek medical attention so that the appropriate tests are done. Because there are many potential causes of what we call dementia, which refers to a group of diseases that are characterized by memory problems, behavioral problems, and difficulty performing activities of daily living. And Alzheimer's disease is just one of them and happens to be the most common cause of dementia among the middle-aged and older population.
And are there ways to avoid catching Alzheimer's?
I don't think we can say that at the moment we know, we can tell you what we can do to avoid. But there are certain risk factors that we know now that can increase the chance of developing Alzheimer's disease. For instance, and some of this we cannot control, but like for instance, the most common risk is advancing age. As we get older, the risk for developing Alzheimer's disease increases significantly. Some people may have familial cases. It happens that the minority of cases may be familial. And so there are genes that may account for the occurrence of Alzheimer's disease in certain families. So genetic is important, but only in a small percentage of population. Diabetes is a risk factor, head trauma, and hypertension may be a risk factor as well. And I think what we're trying to do now is identify more risk factors with the hope that by avoiding the risk or reducing the risk factors, we'll be able to reduce the risk for developing Alzheimer's disease.
How about exercising the mind or appropriate food? How does that affect?
That has become actually a very important focus of research at present. And that's what we call the lifestyle changes. Nutrition is very important, I think. Eating the right food, keeping your health, maintaining good health, reducing obesity, controlling cholesterol, avoiding foods that increase your blood pressure, avoiding diabetes, and if you have diabetes, you need to control your sugar. Physical and mental activities are very important as well. Socialization is very important. So there are certain non-pharmacologic, meaning techniques that we can employ, for instance, that do not require medications. Eating the right fruits and vegetables, for instance. There's quite a bit of research going on the use of certain foods, omega-3 fatty acids, certain fruits and vegetables, and certain diets that may reduce the risk for developing Alzheimer's disease.
It looks very much as the same one would think about preventing a coronary sickness or disease.
I think, as a matter of fact, I think we learn a great deal from cardiovascular medicine. And it happens now that increased cholesterol is also considered a risk factor for Alzheimer's disease in certain cases. We don't have the exact proof for that, but some clinicians would prescribe, for instance, cholesterol-lowering agents to lessen the risk. But we don't have the exact evidence, definitive evidence, that it reduces the risk for Alzheimer's disease.
Dr. Reyes, thank you very much for sharing these ideas with us, and thank you very much.